Women's health care has been on the rise in the last few years, and because the Affordable Health Care Act may be repealed, many women feel like it may affect women's health and contraceptives.
The bill has a primary goal of offering affordable quality health insurance to all Americans. With the Affordable Care Act in place, it has improved health care for women and their families through programs like Medicaid. The ACA also requires health insurance plans to include birth control and contraceptives coverage at no extra expense. On May 4, 2017, the U.S. House of Representatives passed the American Health Care Act to repeal and replace the ACA. It will eliminate the expansion of Medicaid by cutting almost $1 trillion from the program over the next 10 years. The bill would end federal funding for 1 year to states that pay for lower-income women on Medicaid to get reproductive health services at Planned Parenthood. With less money to spend on health care, state legislatures will have to make tough budgeting decisions that could take away funds from programs that benefit women to pay for health services or reduce medical benefits.
Well, if you think about it, you're already paying premiums for insurance. So whatever health care you receive through your insurance is not free because you're already paying for it. But we're not asking people to be required to pay additional copays for a medication just because it's a particular type of medication. And so we're providing, the ACA is providing birth control without additional copayments for women. And this has actually substantially increased the percentage of women who are able to pay for and to afford an IUD, for instance. So it's risen from over 40% to over 90% of women that can afford to use an IUD, which is one of the most effective contraceptive methods.
Before the Affordable Care Act, insurers would have treated sexual assault, domestic violence, postpartum depression, pregnancy, and cesarean sections are pre-existing conditions, charging women who have experienced them more or denying coverage entirely.
I will at some point be affected. I have an IUD right now, so I still have a couple years left on that. Thank you, Jesus. So I don't have to worry about it, tomorrow. It's not like my pills are going to run out or anything like that. But if everything gets changed, and again, assuming that directly impacts contraception, I'll probably have to worry about it in like 2020 when I got to get my stuff fixed.
You have probably seen that the national pregnancy rate, the national unintended pregnancy rate, has decreased significantly, and that's in part from effective use of contraception. And that really means that women have more access to effective methods of contraception.
It depends on your plan, right? So at the time that I had my IUD put in, I had health insurance which covered it. It was not Obamacare, it was through my parents' work health insurance, so that probably is the reason that I might have had to pay a copay, but it would have been real cheap, like $10, $15 or that kind of thing. You can get free birth control if you, first off, go somewhere like Planned Parenthood or something like that, or if you have a plan that is total coverage. But depending on your plan, right now your plan has to cover birth control, but it's not necessarily free depending on your copay.
Well, unfortunately, if the ACA is repealed, then we will see a lot of Americans who have decreased access to health care, and specifically in this situation, decreased access to preventive health care, because currently the ACA offers a guarantee that you're provided contraceptive methods where it wouldn't be so if it was repealed.
Before, insurance companies would only cover drugs like Viagra and not birth control, leaving many women to pay out of pocket for an expense that could reach $1,000.
Being a trans woman, I'm not really affected by birth control issues, but anything that happens in women's healthcare affects me as a trans woman, because what they do in the White House and what they do in the government sets a precedent for what goes on in the healthcare system, and that could negatively affect me in the end.
And so as health care professionals, we are consistent about our recommendations to patients. We offer them the highest quality care and the full range of options that are available to them, regardless of their socioeconomic status or their insurance status or their ability to pay. And then we allow them with that information to make the decision that's in their best interest and best fits their reproductive goals. There are so many available contraceptive methods now that are effective, that are safe to use, that are easily placed within a doctor's office so they do not need surgery.
I've never had any issues with like having to pay out of pocket, but I feel like either way is like, it's like whatever whatever's accessible to you. Like, it's so hard to like transition and like the government does kind of make it really hard to like get surgeries and stuff like that. So however you can like get them, I say go for it. But yeah, I just know I had to do out of pocket because of my family situation.
Again, I would just say that it's really important to make sure that we maintain health care for all Americans, regardless of their gender, and that really makes sure that they have full access to all preventative health measures, and in this case, that includes contraception.
For GSU TV, I'm Michaela Newton.